Hello, my name is Julie Condon. I thought I would share with you today what a thermoplastic splint is. In hand therapy, we use thermoplastic splints quite a lot to treat hand injuries and as an alternative to casting material for broken bones, post-surgery. They can be used to stretch joints out, they can be used to help protect joints, they can help immobilize things, they can also help to relieve pain, and then they can also be designed to improve function. So they're pretty cool, and they're all customized and molded on the person when they come in. So if you need a thermoplastic splint, it comes in big sheets. So this is obviously half a sheet, so this is one that I've got going on at the moment. It's moldable, it's very pliable. You can get all different types of thermoplastic. Some of them aren't as stretchy or as bendy as what this one is, and they come in all different thicknesses. So this one here, if you can see, it's actually only 2 millimeters thick, so it's very, very light. Also has these nice holes, which I'm not sure if you can see them very well, which allows it to breathe, which is really nice in our North Queensland climate. So what happens is I make a pattern of someone's hand of whatever they need, or sometimes I just wing it and cut it out the way that I think it is. When you've made as many as I have, you get a little bit okay with that. Cut the pattern out and cut it out on the plastic. I then put it in hot water, so water about 65 degrees, and then it melts and it goes really moldable and soft. Once that happens, then I can mold it onto the person. So I have a couple of examples here. This is one that I molded onto someone's hand and to their wrist, so you can see, and they open up and they're really nice. But when they're molded to you, so this one wasn't molded on me, it was molded on someone else, so it's, as you can see, it's not a perfect fit. But when it's on and it is a perfect fit, it really limits your movement, and you can make them more or less supportive to enable that, depending on your clinical condition and what the therapist figures out is the right thing to do for you. So it's really quite nice, and they're really comfortable when they're molded right and they're molded to you. So here's another design that we made just for someone's thumb. So this was to protect this area of the thumb. As you can see, this one wasn't made for me either. It's a bit big on my hand. And then what we do is we actually just hold it on with a piece of Velcro. So thermoplastic is amazing, it's really good. One of the really good things about it is that if we mold it when you are quite swollen, as your swelling goes down, I can just put it back in the hot water and it goes fine again. So we have quite a bit of time where we can remold this and remold this over and over again, so that we make sure that it's the perfect fit every time for what you need for your condition, to make sure that you get better as quick as possible. So thermoplastic splints or orthoses are one of those tools. Thank you.